Now that we have considered why it is important to make health facilities physically accessible and some of the common barriers experienced by people with disability, in this video, we will begin to think about how to remove barriers and improve physical accessibility. We are going to touch on two key concepts relating to accessibility. The first is universal design, which relates to planning and designing for accessibility from the outset, rather than needing to adapt later. The second concept is reasonable accommodation, which you may have heard mentioned in previous modules and relates to making adjustments or modifications to existing facilities or practices to make them more accessible. Both of these concepts apply to more than just physical accessibility, but in this module, we will apply them specifically to the removal of physical barriers. While the concept of universal design originally emerged with people with disability in mind, it refers to the design of products, environments, programs, and services to be usable by people of all ages and abilities to the greatest extent possible without the need for adaptation or specialised design. The benefits of universal design, therefore, are of value to the whole population and not only to people with disability. The UN Convention on the Rights of People with Disability requires state parties to make appropriate measures to ensure equal access for people with disability to the physical environment, transport, information, and communications, and includes both indoor and outdoor facilities. Health facilities are included in this requirement, and applying the principles of universal design to health facility infrastructure will go some way to achieving this. Furthermore, it is argued that it is easier and cheaper to include universal design from the beginning when planning a facility or program, rather than trying to retrofit it later. It is estimated that incorporating accessible design only adds to building costs by between 0.5 and 1%, whereas needing to make modifications later can be far more costly. You can find the principles of universal design further outlined on page 41 of the Toolkit manual. On this slide, we have a few examples of health facilities in different contexts. Let us consider from the perspective of universal design and enabling access for all. The picture on the left shows a building with steps leading to the entrance. However, there does not appear to be a ramp available for those who are unable to climb the stairs. This is an example of poor design. On the right-hand side of the slide, we have some pictures where universal design has been applied. There is a picture of a handrail along the wall of a health centre to assist people with mobility or vision impairments. There are also pictures of a ramp at the entrance to a health centre, as well as a ramp between different areas within a health centre. Reasonable accommodation refers to the provision of necessary and appropriate modifications or adjustments where these do not impose a disproportionate or undue burden on those providing them. These serve to ensure that people with disability enjoy the same fundamental freedoms and human rights on an equal basis with others. Reasonable accommodations are a requirement under the UN CRPD and apply to all aspects of society to promote equality and eliminate discrimination for people with disability, including in employment, education, and healthcare. In a healthcare context, reasonable accommodations may include modifying equipment or facilities to enable better accessibility, but it may also include simply moving furniture, changing the location of an activity or service to a more accessible location, using alternative formats to communicate, being mindful of placing information or objects at heights that are accessible to all, or thinking flexibly about how, when, and where to provide interventions and services. By making some simple adjustments to the environment or to the way we deliver services to accommodate patients with diverse needs, we can make a big difference in making healthcare accessible for all. Improving accessibility is not as difficult or expensive as many think. Many existing health facilities may be too costly to alter or retrofit to provide universal access. In these cases, health facilities should consider what reasonable accommodations they can make to improve accessibility and equitable access to healthcare. Many of these can be done at reasonably low cost. For example, clearing hallways, waiting areas, and clinic rooms of excess furniture. altering toilet doors to swing outwards to allow more space inside the cubicle to accommodate a mobility device or support person, and adding grab rails to make it easier to transfer on and off toilets. Making sure reception desks are low enough for people in wheelchairs to see over them, providing clear signage throughout the facility with white on dark contrast, placing drinking water, hand hygiene tools or other items at accessible heights, designating some car parking spaces close to the entrance as accessible parking spaces, specifically for people with disability. If your facility has squat-style toilets, provide an overt toilet frame or seat for those who cannot get up and down easily from a squatting position. Have some fold-away examination tables or cots that are at a lower height than standard examination tables that you can set up quickly when needed for those who cannot get up onto the higher ones. At ramps, at entrances. And finally, think about where you hold certain activities. Can they be moved to a more accessible space, particularly for community education or other group sessions? And for those who find it very difficult to travel to and from your health facility, are there other modes of service delivery that you can consider, such as outreach clinics, home visits, or telehealth consultations? As with other aspects of implementing disability inclusion, it is really important that we involve people with disability when seeking to remove physical barriers and improve physical accessibility. This will help to ensure that our attempts at accessible design are truly accessible and usable by people with disability, and we avoid the oversights that we store in the activity in step 3. A simple way to identify any physical barriers in your health facility is to conduct an accessibility audit. An accessibility audit involves moving through the facility to gain an understanding of the physical accessibility of all areas of your health facility. Ideally, this will be undertaken with a member of a local DPO, a member of the service provider leadership or management team, and where possible, with people with different types of impairment. For example, a person with a mobility impairment and a person with a visual impairment. It should start from outside the facility, from transport access points, and then through the service, including reception or triage, and all relevant clinics or areas that may be accessed by members of the public, including amenities such as toilets. You may wish to use a checklist or audit tool, such as the one provided on pages 47 to 49 of the toolkit manual. As you move around the facility, note areas where physical accessibility can be improved. Identify what can be changed easily and at low cost, and what needs to be included in future budgets. In the final activity of this module, we encourage you to conduct an accessibility audit of your own workplace. Now that we have learned about key principles and strategies to remove physical barriers and improve physical accessibility in health facilities, please return to the workbook and complete the activities in steps 5 and 6.